Welcome to the Practice Builders Podcast, hosted by Dr. Vince Leone and Dr. Kyle Pankonin, your source for building cash services. Let's dive in.
Hello, everybody, and welcome to the Practice Builders Podcast. My name is Dr. Vince Leone.
And I'm Dr. Kyle Pankonin. We're excited to have you with us today, and we think we have a great topic. So, Dr. Leone, I'm going to let you introduce that topic, and I think you're gonna get a lot out of this today.
Absolutely. So the title of this one roughly is "Do Appearances Matter?" Hint, yes. 3 strategies to enhance patient experience. And we all know the adage, or whatever you want to call it, of don't judge a book by its cover. The problem is everyone judges everything by appearance, right? We judge, if you walk into like a Mercedes showroom or a Honda showroom, you're going to judge, you're going to be a little judgy on that. Wow, I like that Mercedes showroom better. Or if you see someone dressed in rags versus someone in a suit, you're going to make assumptions. And so why would it be any different in a doctor's office? And this is honestly, Doc, this is one of the easiest things that we can do to increase patient compliance, increase patient conversion, increase referrals, and it's just so simple. So the 3 areas that we're going to cover is the doctor's appearance, the staff appearance, and the office appearance. So let's dive in. We're going to start with the doctor's appearance, and Dr. Kyle even has research to back us up on this. I love it.
This is really cool. This is actually a brand new study published just this year in Chiropractic and Manual Therapies 2025. The title of the study is Patient Preferences for Chiropractors Attire. And they did it at a university-based clinic. And just going to read a few tidbits of this, but I'll get to the meat of it, and this will be very applicable to you doctors listening to this. So it says there's a significant body of research that has examined how the attire of physicians and nurses affects patient perceptions, preferences, and outcomes. But this is the first study where it was specifically addressed to chiropractors and chiropractic patients. And there were 4 different attires that they evaluated in the study: casual, formal, scrub, or white coat.
Now, would casual just be like, like khakis and a polo, or
No.
And then formal would be essentially like maybe slacks, shirt, and tie?
Or a suit, potentially. Yep.
Okay. My dad used to wear a suit.
Yep.
Back in the 70s, he wore a suit, and he had a little red rose here on the left lapel. That's hilarious. He got known for that, by the way. He was known for his red rose. Interesting little tidbit there. Biggest practice in Washington back in the day. Anyways,
Cool.
Moving on.
Yeah. So, and then of course the scrub, that would be, what a lot of
Scrubs.
in medical
Absolutely.
facilities, and then the white coat.
Right.
And there were 75 new patients that participated in the study. Interesting. So the results indicated a strong preference for scrubs for both male and female chiropractors. Chiropractors in scrubs were also seen as more knowledgeable, trustworthy, competent, professional, and comfortable. This was closely followed by those wearing white coats and formal attire. Notably, this is interesting, the white coat worn by the female chiropractor received significantly more positive ratings than when worn by her male counterpart. Conclusion: our findings suggest that chiropractors' attire influences patient perceptions and should be considered in the development of dress codes for public and private clinics. So here's where the rubber meets the road, docs, I think. If you're one of those docs that is confident and you exude confidence and you are highly skilled and you can attract patients. Probably what you wear doesn't make maybe that big of a deal.
Hmm.
But if you're a little lacking in confidence, you're young in practice, you maybe don't have your clinical skill set as good or as high as it should be, this can really be a game changer here just by throwing on some scrubs, or in the case of females in the study, wearing the white coat
Hmm.
can really up your image amongst your patients, and they're going to feel more confidence in you. They're going to feel that you're an expert, that you're well trained, you're knowledgeable, competent, all those things, just by changing a little bit about your attire. And that can make the difference between, especially in the world of niches like Dr. Vince and I live in, that can mean the difference between a patient saying yes to your recommendations or saying, nah, I think I'm going to think about this. And
Oh,
that can make a difference between having conversions and non-conversions, which over a course of the year can mean thousands and thousands of dollars of potential lost revenue, all because of your tire.
I I couldn't agree more. I think this is one of the easiest things under our control to increase conversion and confidence. And when I was just starting offering neuropathy, and I was asking for $3,500, that was my care plan price. I wore slacks, a button-down shirt, a tie, and a white coat. And in my opinion, I wanted to be the best dressed in the room. I didn't want to, I looked young, thank you very much. I'm 52 right now, feeling 45. But regardless, the gist of this is it's such a no-brainer to just go get scrubs. Everyone, like, here's a recommendation: just go get scrubs. You get scrubs, get your name initialed on it. And personally, I don't really care where your confidence is, because if you want to look like the doctor and have that conveyed to your patient, just wear scrubs. Right. Then what's also nice is you can wear nice and comfy shoes because you're on your feet all day. So that's kind of a functional aspect of it. And then I would wear the white coat in the ROF, right? When you're adjusting, you don't need to wear the white coat. Throw it in your office, throw it over the back of the seat when you are out adjusting. But in your ROF, scrubs, white coat, don't get the long butcher coat, get the either the sport coat one or the one that's slightly longer. And again, get your name and clinic name embroidered on that as well. Make it look professional. And you will see a difference 100%, especially if you're young in practice. But if you're older in practice and say you're offering these niches and you're not getting all the conversion that you kind of anticipate, this would be a really easy thing to make a change ASAP, right? And so that's number one, doctor appearance. We have the data backing it up. Anecdotally, I just always thought this is a no-brainer. I mean, what do you think about that, Dr. Kyle?
Well, it just proves you were cutting edge even before your time, Dr. Vince. The research finally caught up to you, my friend.
Finally, by the way, you can look back in my old training. This is one of the first things I told doctors to do: either scrubs or a white coat and a shirt and tie. So, anyways, it's again, no brainer. If you're young in practice, if you're young in niches, if you're having issues with patient compliance or conversion, this is the first thing to change.
Amen. That's a great point. And it kind of leads us into our next area. So we talked about doctor appearance, well, staff appearance. Well, one easy thing you could do to enhance staff appearance is to have them wear scrubs
Yep.
as well.
Yep.
And so you sometimes do see that in many offices where the whole team is in scrubs. And like you said, the name's embroidered on. They got their own name, clinic name on there. And basically it just amounts to, what color are we going to wear
Yeah.
today?
We would have our girls would obviously all coordinate, right? They all had four different colors, right? There was like a pink, a maroon, blue, and black. And so then they would coordinate the night before. Hey, what color are we wearing tomorrow? We're wearing this. Great. So they should all be in the same color, but your team should be in scrubs, right? Because, well, a couple things. It's going to eliminate and make their mornings easier. Now, if you think that, well, why do I care about their mornings being easier? Well, because their attitude and their mood coming into the clinic, I mean, there's a whole thing called decision fatigue. That's why like Steve Jobs wore a black sweater every day because he didn't want to even have to think about what he would wear that day because he felt he had better things to think about versus what am I going to wear today. So take that decision out of your staff's hands, right? Make it really easy for them. Get them, 2, 3, 4 different sets of different colored scrubs. I personally don't think that they need to have their names script and on there. Having the name of the clinic on there, I think would be good. But I don't really necessarily feel they have to have their name on there. But it certainly makes it look more professional. You just never know how people are going to dress. Sometimes it's really nice. Sometimes it's not so much. Sometimes it's a little risque and you're like, no, 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 that's not appropriate in a doctor's office. Then you have to do correction. It's like, just simplify, 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 and get them in scrubs.
Yeah, and it takes out some of the variability because over the years I've had some staff, some of them dress up very nice, and some of them dress up like, really, that's what you're going to wear to work today? And
Mm-hmm.
so it kind of puts everybody on a level playing field.
100%.
And so I like the concept of it. I like the research behind it. And I certainly think it's something that those listings should give strong consideration to in their own clinics,
Yeah.
which brings us to point number
The
3.
point number 3, appearance of the clinic. Now, this is massive, right? And this starts in the parking lot, by the way. Because people start making first impressions. They start making first impressions the minute they see your ad or they hear about you, right? So if their friend refers you to them, they're probably going to go online, look at your website. They may even dig into your social media. Hey, is this guy a creep? Like, you just never know. There's so much available to people, but we're just talking about locally. So your parking lot should be clean. In other words, it shouldn't be cigarette butts and trash and all that junk laying around, right? That's a bad look. So get that corrected. When they come into your office, just start thinking like, what do they hear? What do they see? And what do they smell? You know what I'm saying? So why don't you kind of dive in there a little bit, Doc, and give your thoughts on patient perception as they come into the clinic?
Yeah, I think the first thing that most people are going to notice is a lot of people, they've traveled from a ways, where they're going to go to. Where's your bathroom? And
That's
where's your
true.
bathroom? They come in and where's your bathroom? And so your bathroom's got to be immaculate. It's got to
Amen.
be
Amen
clean
to
as
that.
a whistle, almost that you would lick the counter. But no, you wouldn't do that. But you know what I mean. They don't want to see a bathroom that's in any kind of disarray, and because that might be their first impression. And
Yeah.
then when they walk into your clinic,
Wait,
what's
can I expound on that a little bit, Doc?
that?
So I remember when I was an associate and I um, just started and I went into our patient bathroom and I was like, yuck, gross. It hadn't been clean. My dad hadn't been in that bathroom for years. He probably never even seen it. And I'm like, Dad, this has got to change. I mean, if we're trying to portray ourselves as a premium service and then they go into the bathroom and it looks like it's from McDonald's, I mean, give me a break. So we went to work, we gutted that whole thing, tiled it, nice custom, sink. We did hand towels, right? We took out the paper towel dispenser and we put little rolled white hand towels, and those, obviously got, laundered every week. So and then had some smell like air freshener type of thing, new toilet, fancy toilet, tiled the floor, nice artwork. We'll kind of talk about that, but nice artwork on the wall in there. But you really should put some time, effort, energy into your bathroom. Dr. Kyle's right. That's sometimes the first thing they do. Go right in your bathroom. And again, very easy to, I mean, look, if you can't dump $5,000 or $10,000 into remodeling your bathroom, that's okay. The first thing is just make it super clean. That's the first thing, is just make it super clean. And then you kind of take steps, you know. Hey, next month we're going to replace the sink. Month after that, or 2 months after that, we'll replace, you know, the floor or the toilet, or, you know, whatever. But the point being is, you probably don't go in your patient bathroom enough. And I know, you know, probably didn't expect to come on this podcast and be thinking I'm going to talk about bathrooms today, but it makes a difference. It really does. So anyways, address the bathroom. Okay, moving on.
Just the bathroom, of course, the first thing they're going to see, maybe not the bathroom, but then maybe the next thing or the first thing will be the reception area.
Yep.
Sit in your reception area just like you were a patient, and look around and see what you see, the artwork and how the cleanliness of the floors, because people sit at those chairs every day. Are they clean, or is there dirt anywhere around those chairs? Make sure that is all cleaned frequently, especially right at the end of every day. That should be cleaned up in that area, and all trash, anywhere thing that is emptied out. You don't want any appearance that there's a half full trash can sitting somewhere in the reception area. And your front desk person, that should be your most people friendly. That should be your schmoozer. The
Yeah.
first person that walks in the door, that the patient is greeted by, that's your schmoozer, is your front desk person. And they should be warmly and enthusiastically greeted when they walk in the door.
Yeah. And if you're doing any type of volume, I would really recommend that front desk person is not taking phone calls. They should not be having to juggle trying to schedule a new patient, which could be thousands in revenue for the clinic, and also having to greet a patient. Maybe they're having to, you know, schedule another patient that's leaving their, you know, their appointment, you know, for next time. So as your volume increases, start to be thinking like, hey, I want this as our ambassador, and I don't want them, you know, having to worry about the phone, because being able to schedule properly, pre-qualify on the phone, educate the patients, that's a whole different skill set. It can be learned 100%, but it really should be. We always had, you know, when patients called in for new patient appointments, hey, no problem, we're going to put you through to Dr. Leone's personal assistant. And that was the only one that was really allowed to schedule patients. And then she would go through, and, you know, they were usually 10-minute phone conversations, right? To schedule the patient. And you'd be like, well, why would it take all that? It's because they're pre-qualifying them. You know, all these doctors talk about, oh, I want better quality patients. Improve your phone skills, right? Improve the ability and the questions that your person talking to the patient has. And of course, in our program, we have, in fact, we just did another training on this, but ideally that ambassador, right? Big smile, just like Dr. Kyle said, they should be bubbly. They should be energetic. They should be, hey, are you Mrs. Smith? I saw you on the schedule. Welcome, blah, blah, blah. I mean, they don't have to jump out of their chair and climb over the desk, but they should, they should be warmly greeted. The worst thing in the world, coming into a new doctor's appointment, the head down, they're like scribbling something, or they're on the phone, or good Lord, they're on social media on their phone.
Yeah.
And you're like, I'm here for an appointment. Good luck. Terrible first impression.
Terrible first impression, or instead of warmly greeting them, hi, do you have your insurance card? I've heard that line a few times over the years, and I've had to correct that one. It's like, no, you don't. That's not your opening line. Do you have your insurance card?
Oh, that's a great one. Man, that's a not a fireable offense, but that's certainly, you're going to see the doctor at the end of the day offense.
That is an offense that needs to be corrected right now, or
Yeah.
at the end of the day for certain. So there's a few other things you want to keep in mind. So I think one of the overlying themes is obviously cleanliness. If if you're doing well enough in practice, then spend the bucks to have a professional come in and thoroughly clean your office at least once, if not. We have a gal, two different gals that come. We have it ours thoroughly cleaned twice a week.
I
Our
love that. I was just going to
offices.
ask you, how often do you have them do it? Twice a week?
Minimum of once, but twice would even be better. Once towards the middle of the week and or when once at the end of the week
Yeah.
so that it's always clean. In fact, I got a gal outside of my door right now. She's cleaning and I can hardly hear what's going on.
I
The other
think
thing,
that you can't state that enough. It's got to be cleanly. And I think that, one of the kind of end of day tasks on, like, say, your tech, right? Everyone should be responsible for their area first, right? So at the end of the day, hey, clean it up, put the laser back in proper place. Like, your workstation shouldn't have, 5,000 post-it notes on it. I mean, everything should be organized and cleanly. And then, one person's responsible for reception, one person's responsible for the exam rooms, one person's responsible for x-ray room. Like, what I'm saying? It's just like, hey, they have this little like area that, boom, I clean up my station and then I have one more station and then I'm done. Right. So that should be their kind of their exit activities. It shouldn't be you, but you should be doing checks. Like, I would walk through your office at the end of the night and just, straighten that chair, pick up this little piece of lint, like whatever. It should be darn near perfect at the end of each night.
one thing I've learned that keeps staff very happy over the years too is you as the doctor, even though it's not your job, no, but yet you shouldn't be above it. In other words,
Hmm.
if your work area is not tidy, take some responsibility and clean up your own work area. Or if you're walking down the hall and you see something is laying there that shouldn't be, or a piece of lint, or don't be afraid to bend down and pick it up yourself. And if your staff catch you do that, they'll think they'll respect you more, and they'll think, oh, Doc doesn't think he's above me. And
Hmm.
it's a way to show some humility. Even if you are an uber successful doctor, don't don't get such a big head that you're afraid to do the work of the common man or woman. And so that's something I've learned over the years that has served me well.
Well, that's a good point. In terms of smell, we've
Yeah.
we cycled through lots of different options, and a lot of the stuff that you can plug in, I found that a lot of patients, or some patients, would be really sensitive to. And then you get, some patients that walk in the office and almost turn around and walk back out. Ah, God, ooh, what is that? It's
Yeah.
like they just really have a strong. So there should be a scent to your office. It should be faint. We ended up, in other words, the thing that gave a nice scent to the office, but did not cause any adverse reactions with patients was, I believe is called Scentsy. I don't know if they still have this, but it's essentially little thing. They burn wax, right? They heat up the wax, and it's a wax cube that smells like something. And so when it burns it, it makes the office smell nice. So I don't know. What are your thoughts on that? And by the way, we used to get fresh flowers delivered on Monday. So I always thought that was kind of a cool thing, for $50 a week or $30 a week or something, having fresh flowers. I know the older women always really appreciate that. But just on smell, what are your thoughts there, Doc?
Yeah, we use an essential oil
There you go.
diffuser that's, kind of it's back behind our main front desk area so that it emits just this nice little
Hmm.
scent to the waiting room area. And so that at least that's one of their first impressions when they come into the clinic. I can't remember what essential oil that the gals use in it,
Doesn't
but
matter.
it smells good.
Yeah. How about on the walls? What do
The
you think there,
walls.
Doc? I mean, I'll just, start off with, if you have a poster on the wall and it has some type of chiropractic thing and it doesn't, it's at least I mean, I'm not a huge fan of all the chiropractic, you know, all those posters and all that stuff. To me, that's very 80s and 90s. But if you're going to, this was always a rule that my dad had. If you're going to have something on the wall, it needs to be framed.
Yep, that's exactly what I was going to bring up. My 2 points would be is if you got posters, don't just tack it on the wall and have it just be
Terrible.
the paper. Have a nice professional looking frame or do nice artwork. So I have mostly education based posters, but they usually line up with the niches so that I can use for patient education that shows stuff about like the disc
Mhm.
and spinal stenosis and things like that. So that when I'm not in the room with the patient at the time, they can look and, oh, is this my condition here, doc? And so it's pretty educational based, but they're all in nice frames and stuff.
Mhm.
And some doctors have gotten away from the educational posters and they're just some type of nice art. And I think that is also a nice touch also. Or you could have a blend where you have maybe a few strategically placed posters, but that's not every room or taking up every wall of the room. But then on another wall, there is a nice piece of art. So that the more ones that want to learn something, well, they're going to gravitate to the poster. But then, oh, here we go. We have a nice piece of art that they can just enjoy, and it creates a relaxation, a comfort. It elevates their mood, especially because a lot of these people are in pain. And
Mm,
so
good
if you
point.
have something that can create more of a calming effect where it takes their mind away from their pain and onto something more peaceful, that can be a good strategy.
I think that's great advice. My rule of thumb would be art in high traffic areas and educational material in exam and like x-ray rooms, right? So, in the reception area, in a hallway, in if you're doing open adjusting, maybe in open adjusting, I would go art. That's what we did. And then in the rooms themselves for exams and report of findings, then you can go more educational in nature. Um, I know in our ROF, we did a lot of, we talked about having our wall of kind of social proof where you'd have framed testimonials from patients. I think that's something that could be really nice. So yeah, I think just try to be a little bit different. But and here's the beautiful thing is if you go online to like online artwork type of if you search that, you'll find and I would have a theme to the office. Like when I finished my associateship, I had no money whatsoever, but I started my own clinic, and a friend of ours had traveled to Italy, and she took these really great photos. So I said, "Hey, can I get copies of those?" And I just blew them up and framed them and put them around the office. So that was our theme, just like Italy, right? Italy slash travel slash water. So I would kind of try to, if you could, think about, hey, what's kind of the theme for our office, and then that can steer your thought process on the artwork that you choose.
I had never heard of that concept before, developing a theme. That really strikes with me that that would be and then you could change that theme up year to year too. And
Absolutely.
yeah. So I think we covered most of the things. Any other input on things that they need to consider in the office as far as attire or the staff or just things around the office, Dr. Vince?
I mean, I think we've hit the highlights, and what I would encourage doctors to do is, this is your business, and so I would think of it like your palette, right? This is your like we talk about in the ROF, how actors have their present, they go on stage, and then the ROF is your stage. Well, your business is a representation of you. So I would put some time and energy into thinking like, hey, what is the feeling that I want patients to get when they come into my office, right? And then I would have that lead your decision making on all these things that we've talked about, right? The look of it, the feel of it, the smell of it. Are you going to do carpet? Are you going to do tile? Are you going to do a blend? Um, you know, so I think it's just a matter of getting first of all, putting some dedicated time and thinking into it, and slowly execute. Again, you don't need to, dump thousands and thousands of dollars into this right away. It's just like, let's start with the basics. Hey, take care of yourself first, right? That's number one. Take care of your team, and then start taking care of the presentation of the office. And this is all just an evolution of going to that next level and being that premier destination that, most doctors that I talk to, that's what they want. They want to be the premium destination. And so when you do things like this and you put concentrated thought into it, whether the patient voices the opinion that they recognize it or not, they will, right? Because rarely does anyone do this. So you can immediately set yourself apart by putting some effort into this.
And I think that's the big thing, is setting yourself apart. Some of these might seem like little things, how you dress but to the patients, this can elevate you a notch or two or three above any other places they've been, whether it's another chiropractic office or any other professional office. If you do these things, it's going to elevate your image and your clinic's image in their mind, and that's going to lead to greater success. That's the bottom line.
Absolutely. So I think that's going to put a wrap on this episode. Do appearances matter? Yes, they do. We went through 3 ways to approach that. So just to wrap up, I want to dedicate this episode to my father. He has decided to retire. So after 57 years, I think it's 57 years in practice, he is hanging up his adjustment. He'll probably always be adjusting, and he's just a doctor through and through, but I wanted to just recognize him for that and his dedication to this profession, to healthcare, and to all the thousands of patients that he has helped in his career. So with that being said, for Dr. Pankonin, I'm Dr. Vince Leone. We'll see you on the next episode.